Have you ever considered becoming a nurse? If you like science and you like helping people, then nursing might be for you. So, what do nurses do? Well, I've been a nurse for 37 years and I've done a lot of things. I've worked in hospitals, which is probably what we all first kind of think of when we think of nurses. I've worked in doctors' offices and I've worked in school nursing offices. I've worked in people's homes to help take care of them along with their families. I've worked as a research nurse to help us learn how to make better medical decisions. And right now, I'm teaching. I teach at a college to help students learn to become nurses. And I've worked with all kinds of patients. I've worked with younger patients, I've worked with older patients, and I've even worked with professional athletes. Think of a time that a nurse may have taken care of you. It's likely that when you were born, there was a nurse there to help bring you into the world. The nurse at your doctor's office may have taken your blood pressure, measured how tall you are, or maybe given you a vaccination. And of course, your school nurse. I remember my school nurse, and I remember that when I used to go to her office, she always said just the right thing and always made me feel better, even if it meant making a phone call to have my mom come pick me up. There are lots of things about nursing that I love, and I've never regretted making the decision to become a nurse. I feel very fortunate to do the work that I do. The rewards for me are really in seeing my patients get better. When patients come to the hospital, they're not feeling great and they're not themselves. And when they go home, they just are anxious to get home and start feeling 100%. So we never really see them at their best. But what I do love is when patients come back after they've gone home and they're feeling stronger and they come back to visit. They don't necessarily remember my name, but they do remember my face, and they always remember the way I made them feel. And when you have the power in your job to help people feel and be better, that's pretty special. Some of the challenges with nursing right now are that there's a nursing shortage. There are not enough nurses in the healthcare system to take care of the demands we have for patients who need to be cared for. It's been a challenge for a long time, and we continue to try to meet the needs of healthcare and the people in the community who need to be taken care of by working to educate more and more nurses. It's a tough job, and it's not for everybody. So how do you become a nurse? Well, I teach nurses. I teach college students to become nurses. So you need to go to college. Some colleges you can go for 2 years and some for 4. Either way, at the end of that, you need to take a special test to become a licensed practitioner, to become a registered nurse. It's a lot of work, but it's well worth it. So to explore nursing as a career, I would say a few things. Do some volunteering. If you like helping people, volunteering is a great way to get comfortable with it. Many of my students volunteered in homeless shelters or in soup kitchens or volunteered in summer camps, and that helped them to feel like a nurse, to feel about that caring piece of nursing, to feel like, does this fit for me? Shadow someone. Shadowing is following a nurse around. You may not be able to do that in the hospital because of the rules of the hospital, but you may be able to observe a nurse in a doctor's office or the school nurse's office or at a summer camp. There are lots of places where nurses work where you can observe them and see if it looks like something you would like to do. Do some helping jobs. Things like taking care of people's pets, doing some errands for someone in your neighborhood, maybe an elderly person in your neighborhood that can't drive and doesn't get out much, or just going to visit at a nursing home. All of these things are really important and they make people feel better. So helping jobs are good ones to get because you can't become a nurse until after you get the education, but you can practice your caring in the meantime. Lastly, you need to be a learner. Nurses have to study pretty hard in nursing school. And then when we get out, we still need to learn what's new in nursing. How can we do our jobs better? It's not that you have to be the smartest person, but to be curious and to want to learn, those are things that nurses do. And it's important because you need to keep up with the pace of science and medicine. Lastly, caring. I can't teach you how to care. It comes from inside. So nurses are special in that way because we care. Think about it. I might just see you at work someday.